So, good afternoon or morning, depending on where you are in Canada or around the world. Welcome to Fibromyalgia Association Canada's Fibromyalgia Awareness Month Roundtable. I am Trudy Flynn, Chair of the Board of Directors of Fibromyalgia Association Canada, or FAC as we like to call it, and I'm going to keep my comments brief so we can get right to the roundtable. I'd like to acknowledge that we are on the traditional and unceded territory of Indigenous people across Canada, including First Nations, Métis, and Inuit. We honor their enduring connection to the land and are committed to fostering respectful and meaningful relationships with all Indigenous communities. I acknowledge and give thanks to the land on which we live, work, and play, and to the people who cared for it. I am speaking to you from Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. In Nova Scotia, we are all treaty people. So now to introduce our panel, we'll start with Tyler Dillman. Tyler is a physiotherapist and owner of One-to-One Wellness. Tyler's commitment as a healthcare professional is to create a safe environment for individuals to learn how to integrate healthy lifestyle practices that enhance quality of life and increase participation in meaningful activities. Tyler's a graduate of Dalhousie University's Master of Physiotherapy program and has a Bachelor of Science in Psychology from Mount Allison University and a Bachelor of Kinesiology from Acadia University. With interests in pain, behavior change, therapeutic relationship, and chronic pain, Tyler's whole person philosophy to patient care is based on understanding an individual's health is influenced by the complex interactions among many biopsychosocial factors. Through listening and validating patients' experiences, Tyler aims to create successful, unique, and meaningful treatment plans to help optimize an individual's health. When not at work, Tyler can be found spending time with his wife and two sons, exploring hiking trails and discussing fantasy sports with his friends. And next on our panel is Dr. Andrea Furlan, and she is a physiatrist and pain specialist at the Toronto Rehab Center. She's also a scientist at KITE and the Institute for Work and Health. She's a professor of medicine at the University of Toronto, and in her spare time, she posts videos on her YouTube channel. Dr. Andrea Furlan is on a mission to help chronic pain sufferers restore their ability to live a fulfilling and happy life. She has recently released a journal that is an attachment to her first book, 8 Steps to Conquer Chronic Pain, and she has been a guest on many podcasts, radio, magazines, and blogs. She's passionate about teaching healthcare professionals about how to properly and effectively help people with chronic pain and fibromyalgia. She is the chair of Project ECHO Chronic Pain and Opioid Stewardship, funded by the Ontario Ministry of Health, a program that mentors healthcare professionals in rural, remote, and underserved areas of Ontario, and has recently been awarded a Health Canada and a CIHR grant to expand and study Project ECHO Chronic Pain across Canada. Andrea is also the PI, along with myself, on a CIHR grant that FAC has received to work on tools for patients and tools for healthcare providers, how to help people with fibromyalgia. And last but not least, Eleanor McGroty is a compassionate psychologist dedicated to helping individuals manage emotional and physical distress and pain, including those with fibromyalgia. With training from McGill University, the Calgary Counseling Center, and various research and clinical settings, she brings a wealth of knowledge and experience to her work. Eleanor collaborates closely with clients to develop personalized treatment plans that address both physical and emotional challenges. She is passionate about interdisciplinary collaborative care, and values being part of the team at One-to-One Wellness, where she works alongside physiotherapists, massage therapists, and other professionals to provide comprehensive support. Through this collaborative approach, Eleanor ensures that clients receive holistic care that integrates psychology, physical, and therapeutical strategies to manage pain and distress. With extensive experience supporting individuals facing pain, stress, depression, anxiety, trauma, and more, Eleanor integrates evidence-based approaches to activate positive change while addressing deeper causes. So let's move on to FACT's very first roundtable discussion. The objective of this roundtable is to explore how people with fibromyalgia can cultivate strength and resilience with support from interdisciplinary medical care. So I'm going to start off by asking the panel a couple general questions about how they define resilience. So I'll start with you, Tyler.
Well, first, thank you, Trudy and FAC for inviting me to this and all that you do. Absolutely, I feel very privileged to be here today. So, how we would define resilience, or how I would define resilience, is really someone's ability to kind of like withstand the challenges that come with fibromyalgia. The not only like the day-to-day, but also the challenges that come with communicating what they're experiencing to their healthcare providers, their loved ones, their work, to try and help people understand in a way of what their day-to-day life looks like and the challenges, and the being able to withstand the challenges in being able to move and introduce movement and improving the well-being. So kind of day to day, being able to do those things is how I would start to define resilience as somebody living with fibromyalgia.
Thank you, Tyler. Andrea, do you want to go next?
Yeah, sure. When I asked my husband, he's an engineer. I was writing my book and I had to write a definition of resilience. And he said, wow, this is a term that we use in engineering. So I did not know that the origin of the term resilience comes from engineering. So I brought a little illustration here. So resilience is a characteristic of materials. So here I have a piece of flannel, and here I have a wrapping paper. So these two materials have very different resilience. So this is very resilient, which means that it can go under stress. I put this material under a lot of stress. And when I open, the material is very similar to this original state. Now, if I get this piece of wrapping paper, you know what's going to happen. I put this paper under a lot of stress, and now it doesn't come back to the original state. This one by itself, if I just hang it, it comes back to the original state. This doesn't. So when I wrote my book and I had to explain, so I say resilience is something that you have it from the womb of your mother. Resilience doesn't come in a pill. It doesn't come in a book by reading a book, or it doesn't come by watching a video. It's something that is with your personality, the way you grew up, the way that you confronted stresses and challenges in your life, and you are building that thing called resilience. And that is what we need. That's exactly what Tyler was explaining, is your ability to endure stress. So this material is very resilient because I can put it under a lot of stress, and then it comes back to what it was before. So we need to help our patients with fibromyalgia to become this and not this. It's teachable. It takes time because it's something that you bring since your childhood.
Thank you. That was an interesting definition. Eleanor, how do you define resilience?
Thanks, Judy, and thank you so much for having me. I would definitely be expanding on what Tyler and Andrea have shared. Uh, for me, resilience is a lot about adaptability and flexibility. So the demonstration of the fabrics, I think, beautifully captures that, right? I also like to think of bamboo, which is strong and has the capacity to grow really high. In fact, bamboo grows 1 year underground, like hundreds of meters, and in the second year, it shoots up to like 100 meters in a year or 10 meters in a year, depending on the climate. But nevertheless, a very strong plant, but highly flexible. It can really bend in the wind. When something is very rigid, including our daily lifestyle or our view of the world, we may not have as much resilience, even though we come across perhaps as super strong and grounded. So I think adaptability, flexibility is a huge part. And then it circles back to a lot of what Tyler was sharing, that it's the ability to develop and maintain well-being, psychologically and socially and in our daily life. So yeah, I would sum it up like that.
Oh, thank you. I want something I skipped, but I shouldn't have was I really want to thank you guys for being here. I really, really appreciate it. And as I was going through your bios, I was realizing how much experience and talent we have on this screen. And it's really great to know that we have three very strong and very well educated and very compassionate people who are helping the fibromyalgia community. And your definitions really prove that. I think, yeah, that it was just one complete definition listening to the three of you, right? So before we go on to individual questions, I want to ask though, how do you think resilience impacts long-term outcomes for people with fibromyalgia? Tyler?
Well, it's essential in my opinion, um, because the road is a bit rocky with fibromyalgia. Um, there's pain, there's fatigue, and there's many other symptoms that come with that. There's some days that feel really good, right? There's some days that don't. And it's being able to be flexible and be adaptable for those days that will set an individual up for a bit more success down the line, being able to know that this is a period. I have to get through this period. And so I feel like resilience is one of the bigger factors to help somebody have a bit longer term outcome and attaining those meaningful goals that somebody has set.
Um, so Andrea, how do you answer that question?
Can you please repeat the question?
Well, how does it impact long-term outcomes for people with fibromyalgia?
Impact the long-term outcomes. Yes. Yeah, fibromyalgia is a chronic disease. And like any chronic disease, they need to do things that will help them endure it. It's like a marathon. It's not going to, don't think about the little steps that are little things that happen in your life. In resilience will help you to win in the long term, not each one of the daily struggles. That's how you build resilience, by overcoming the little struggles and stresses in life. But your goal should be a long term. This will help you immensely to achieve your goals that you want to have 6 months from now, 5 years from now, 10 years, 50 years from now. So helping them to understand this is extremely important.
Eleanor?
Thank you. I liked what Andrea said before about resilience. There's something about our entire life journey, including prenatally, that equips us with a certain degree of resilience, but it is something that definitely can be built a capacity. I remember for years I had an amazing supervisor, a psychiatrist, and he was speaking about, everyone's life will have pain, emotional and physical, and everyone's life has a lot of uncertainty. When we're children, especially if we don't have too much adversity, we kind of have this delusion like one day I'll be an adult and it's all figured out. And that's definitely not the case. And it's absolutely, unfortunately, super not the case for someone with fibromyalgia. There's a lot of uncertainty, and there's, generally speaking, higher levels of pain and frequency of pain, which is incredibly unfair. So there needs to be a lot of resilience for that long-term journey, the adaptability, and what Andrea is mentioning too about goals, right? I think resilience are tools, but each person needs to be given light and support to have a vision for life, to have little things and big things that create meaning and joy. And resilience is the tool to keep going. I think perseverance as well, especially in the face of adversity. And with fibromyalgia, a giant challenge which impacts on so many levels is the invisibility of it, the invalidation, or even the denial at times. So that perseverance and resilience are really key tools in the long run.
I would add something to that too, is because it's an episodic disability, it's when you're doing fine and then you hit a flare, it's like it's difficult. Flares are really difficult, and they do test your resilience. Yeah. So, Andrea, I'm going to ask you a question. So, from a physiatry perspective, how do you help patients develop resilience while they're trying to manage the pain and fatigue of fibromyalgia?
Mm-hmm. Well, this is actually the core of physiatry because many people don't know what a physiatrist does. So let me just take a little explanation here. A physiatrist is a medical specialty. It's one of the oldest specialties in Canada because of the war, people who came from the First and Second World War. So we are the physicians of a person with a disability, people who had a quadriplegia, a spinal cord injury, or an amputation, a brain injury, or a rheumatological. So it could be a small disability, a big disability, a visible disability, or an invisible disability. And we use principles of rehabilitation medicine. What are the principles of rehabilitation medicine? Is something happened, now you have a disability, and in the case of fibromyalgia is maybe nothing happened, you just developed this condition, but you have a disability, and fibromyalgia is an invisible disability. And then we say, what are the functions that you have? What are the pieces that you still have? Let's work with those things to give you the best quality of life. So I always give my patients examples of quadriplegics. You probably have seen them on the internet. They are able to do much more than I am. I don't have a quadriplegia, but I can't do things that some quadriplegics can do, like play in the Paralympic Games and play basketball that in a wheelchair. I can't. I can't even put a ball in a basket and they can. So a person with a disability, they can be much more functional than a person without a disability. And that is what I try to use. This principles is that physiatrists use to rehabilitate any condition. That's the principles we use for fibromyalgia. You have an invisible disability. There are some things that you cannot do because your function, because your brain fog, because of the fatigue, because of the pain, you cannot do some things. But look at the things that you can do, and how can you become a super person with those things that you still have? And your mind, your thoughts, your inner resilience is the main thing that you still have. You are intelligent, you're bright, you can learn, and you can do amazing things. So that's what we use in the principles of rehabilitation medicine.
That's a very good answer. Yes, thank you. That I've never even thought of it that way, actually. So, Eleanor, I'm going to move to you and ask you, what are the most effective psychological approaches to building inner strength and self-efficacy in fibromyalgia patients? type of things do you do?
Okay, that's a great question. It's a huge question. Always go for an individual approach. I myself am an integrative psychologist and an integrative psychotherapist. So that means I'm trained in a variety of, orientations and tools, frameworks, and use a very collaborative approach to individually pick and choose and try with, definitely always a little bit of trial and error, how we're going to mix different approaches. I don't think there's really a blanket approach for anyone, definitely not a manualized approach for anyone. With that being said, some frameworks that I think can be super effective, a general narrative approach, and a person-centered approach for sure. Therapy is a professional, therapeutic, clinical process, but it's a very human one-to-one or group process. It's incredibly human at the core. So having space for the person to be very comfortable to tell their story. Maybe we do a little bit of reframing of the narrative eventually, but the story as they experience now, the stories that are big in their minds, big in their hearts, I think that's a very, very important part of any therapy process. The histories, the stories and hopes or lack of there for the future as well are very important. Some practical tools, for sure, cognitive behavioral therapy approach, CBT, the connection and a little bit of education on, of course, how thoughts, feelings, behaviors, and physiological sensations and experiences are all related. And for anyone, going in with a magnifying glass for a couple of weeks to examine ourselves and understand and see kind of some patterns with triggers, points of days, that insight can be very helpful to then fine tune what change we're going to work on or how we might try to challenge thoughts, reframe thoughts, find the patterns in terms of different unhelpful thinking styles that could be very prevalent for anyone and definitely for someone with fibromyalgia. For me, somatic work, anything that is helping regulate the nervous system, which I know is trending right now, but for good reasons, right? The nervous system, how we experience it, how it is activated and over alarmed at times has a huge impact on our physical health and mental health, which I think we falsely separate too much, right? These things are completely interrelated. Just even the cortisol levels, for instance, the dysregulation, which already is a challenge for someone with fibromyalgia, out of their control, through learning how to activate the nervous system, just with simple breathing, grounding work, light movement, even singing. Sometimes I tell people your homework is to sing or to chant. Getting some vibrations. This can help a lot regulate the nervous system, regulate the cortisol levels to decrease inflammation, help with sleep, levels of anxiety and depression and all of that. So yeah, those are a few. I think I already mentioned like a solution-focused approach as well. Look at what is working and build from that. And very much so like a holistic approach, looking at someone's social life, their occupations, their interests, maybe their work or their schooling, how they experience their body. Yeah, the whole picture. Everything's important.
Wow, that's interesting because it's true. Mindset does matter, doesn't it?
Mm-hmm. Of course. Yeah. It's not like voodoo. It really has an impact very biochemically as well.
So, Tyler, I'm going to ask you a question that we get asked here at FAC all the time. How do you encourage physical activity in patients who fear movement or fear that they're going to worsen their symptoms? That's a huge question we get asked, and it's a huge issue.
Yeah, it's a big one, right? And with what we know, like physical activity and movement are it's a key management strategy for managing fibromyalgia symptoms. And I think that there's a couple things that really come to mind. One is there has to be an education component to this, right? We have to help people understand fibromyalgia and what we know about it in the sense of like sensitive alarm systems and that hurt doesn't always equal harm. Like that type of messaging can be really, really important to reduce just fear of movement and elevated symptoms. Uh, I also feel that there has to be, um, we have to acknowledge especially as a physiotherapy profession, how we've approached it previously, right? And just continuing to challenge and strengthen your body and kind of almost encouraging people in a way to keep pushing through symptoms and validate to the experiences that people have had trying to move their bodies. And I've heard a lot of this today already with Eleanor and Dr. Furlan. It's kind of like trying to meet people where they are, right? In where they feel like they would be confident in starting movement. And one way that we can start to think about movement is it's just not as a continuum, right? Movement starts with kind of that thought and that fear based at the beginning, right? If we're not working with that a little bit and I'm saying, hey, do you know what? Go walk 20 minutes and you're going to be fine, right? And we haven't set up a really safe environment to explore this conversation. I might be missing the fact that they've tried this before and it's really scary because it's led to 3 or 4, 5 days, maybe a week of elevated symptoms, right? So we can start there and just kind of have even do some like visualization of movement. We can maybe even start a little bit of with a mirror, or we can have them watching other people move, just to try to reduce the fear of that movement itself. And then from there, we want to make sure that we have set really, really good goals and meaningful goals, not goals that I've set as a healthcare provider because the research says this, right? It's goals that mean something to the individual and what they either want to maybe get back or something that's been taken from them as a result of pain or the symptoms that come with fibromyalgia. So once we kind of establish that, then we can create a framework for movement and why we're doing this type of either movement, whether it be the somatic based work that Eleanor had mentioned, whether it be working on cardiovascular fitness, which is really important, or strengthening, right? So which one is the best starting point for that person in front of us? And so that's kind of how I would start it. It's like the classic I'd say healthcare response of it depends, right? But it really does based on the person and the information and the experiences that they have. So, but I think there's value in understanding when it comes to movement and exercise. It doesn't have to be all in, right? It's gradual, it's slow. We want to improve somebody's confidence in their own abilities to do it. And then you're also in that moment with movement and exercise and physical activity. We know that this is a sensitive alarm, so we can't always define our success of that just by the immediate sensation of pain, right? We want to understand, okay, does that immediate sensation, can we challenge that? We should respect it, but can we challenge it? So 24 hours later, maybe 48 hours later, has everything gone back to like our baseline of that pain, right? If so, we're in a good window because that alarm system is gonna let us know, hey, we have to protect, we have to protect, we have to protect, but we can find ways to challenge that with still respecting it. And recovery time is a really good thing, I find, for people to understand from a physical activity event, and if we are in the right starting point or not. And we can modify and adapt as we go based on an individual's experience. And I find from a physio perspective, which can often feel very like black and white and very linear in the approach. It starts to bring in a very creative element of when do we challenge, when do we maintain, when do we scale it back, right? Those are all really key things because they all happen throughout the process. So yeah, that's how I would start. Encouraging physical activity and understanding there's so many ways that we can approach it based on individual experiences.
And I find here at FACT, we try to use the word movement because the word exercise really scares people. And doctors, unfortunately, use the word exercise. So it's, something we're working on. So I'm going to go back to asking all three of you, how can patients balance acceptance of their condition with motivation to pursue an active, empowered life? Andrea, do you want to start?
Yes, sure. Do they have another option? I would start like this because, and I mentioned this to them. I say, if I give a patient diagnosis of diabetes, like you have diabetes, and you will be on insulin, from now on, do they have another option? Like, can they say, no, I don't accept this diagnosis and I'll try some. So there is no, no other option. So first is acceptance. And maybe Eleonore would be more expert in this, but I'll just use some language of acceptance and commitment therapy here. I tell my patients, if you don't accept, it's like you are in a tug of war with a monster constantly. And if you can imagine yourself with another monster, a monster on the other side of the rope, and you're constantly trying to fight that monster. No, I don't have this. I don't accept this diagnosis. Maybe the doctors are wrong. Maybe I have something else. And then you don't engage in the treatments that Tyler, by the way, I wish all my patients could have access to you. And if they don't engage in things that Tyler was explaining, they spend years and years in that tug of war. And what acceptance means is not, I'll give up and then we'll never try to find a cure for fibromyalgia again. No, that's not what acceptance means. It just means drop the rope, stop fighting the monster, drop the rope. You're spending too much energy trying to fight the monster. Once you drop the rope, you have some energy to live your life, to do the things that Tyler was explaining here. The monster is still there. The monster is now by your side. Doesn't mean the monster went away. The monster is tired too because it has been fighting with you. So the monster is there and both of you are sitting side by side and you look at the monster and say, well, you're not so scary as I thought before. Why I spend so much energy trying to eliminate you from my life and deny you? Now that you are in my life, okay, I have fibromyalgia, fine. I will live my life with you or without you. If you want to come with me, just come. And all your energy that you had spent before trying to eliminate the monster, get rid of the monster, deny the monster, now you can spend doing the movements, the exercises, the therapies, the things that Tyler and Eleonore ask you to do. So it's extremely important to accept, stop denying, and that will give you motivation to fight it. And then you can still try to find something that will improve your life. You can try medications if the doctors prescribe them to you. You can try other treatments. You can still try to eliminate the monster, but stop fighting a fight that you are not going to win.
Wow, that's an excellent explanation. I'm going to ask you the same question, Eleanor.
Yeah.
So
it's a giant question. I think first we need to acknowledge that two things that maybe feel in opposition can always be true. And, we can look at this. I can be angry and sad, for instance, at the same time, right? Like life is complex and our experience of things is complex as well. Fibromyalgia is absolutely complex. Acceptance of fibromyalgia can definitely be complex, and it can at times be maybe a little bit more complex than, let's say, something like diabetes, where there's a bit more sometimes of a black and white diagnostic assessment and process. I know someone in the chat has mentioned the symptoms are overlapping with other health challenges, surgeries, and all of that. And I have seen sometimes, working with people where the acceptance piece is complicated because they're like, maybe something else is missing, maybe there's another explanation, right? So I think we need to acknowledge that complexity and that gray zone aspect of it. For me in the psychological work, we sit with that often for a long time, right? And maybe where the acceptance some days an 8 out of 10 and it might slide back down to a 6. Some days it might be a strong 10. And I think that is okay, right? Accepting that we don't always accept is also perhaps okay. But the space for someone to have that, to speak about that, whether that's with their partner, a good friend, someone else living with this complexity, or a therapist of any sort, including someone like Tyler, who is so healing, for instance. And we can always work on motivation, kind of regardless of acceptance. Sometimes some healthy compartmentalization and just working on tools and saying like, yep, the acceptance is only here today, but what's important to you, right? How can we just decrease distress? How can we decrease dysfunction? But even perhaps more importantly, how can we increase satisfaction, psychological safety, connection with yourself, connection with others? So yeah, I think it's really about opening up and then sometimes, a little bit of that compartmentalization as well.
Thank you. Tyler, do you have an answer to this question?
Hard to follow those two up sometimes, isn't it? Uh, from my perspective, I feel both Eleanor and Dr. Furlan alluded to this, but often, acceptance isn't giving up, right? And that's kind of the biggest thing that I've noticed. And often when it comes to from like a movement-based practice, it is often allows for more appropriate pacing techniques, right? We avoid the boom or bust, and then also like maybe the fear avoidance strategies that can start to be present, that can lead to greater sensitization over time, right? With activity. And so I think that's probably the biggest thing from I think how to balance that is understanding that we can sit with that monster, and you're looking at energy consumption perspective, right, of how much energy it takes to be in that tug of war constantly, right? And so freeing up energy, not only for anyone but especially those living with complex conditions, can go such a long way for opening up that energy for other things that are really valuable and important. So, but I think we all kind of touched on this is acceptance isn't giving up on your goals, and what you want to get out of life, right? So,
Well, I'll just ask the same. I'm going to ask another question actually that along the same lines. So, the grieving process, people, before you can get to acceptance, you have to go through that grieving process of your life. So, starting with you, Andrea, how do you deal with that, or how do you get your patients through that phase so they can work towards acceptance? Andrea?
Oh, yeah. So, like any grieving, when they receive the diagnosis, and sometimes I am the first one that gives them the diagnosis of fibromyalgia, it's important to give them time to understand and learn. Some people take longer, some people take shorter, some people cry in front of me and they say, oh no, I heard about this, I don't want this diagnosis. And some others, they come to me already, with the diagnosis of fibromyalgia. Each person is different, but I think it's important to give them time and give them information so they can digest what is. fibromyalgia, I usually send them to FAC website. It's excellent. And I also tell them, you're not the only one. There are so many other people. This affects a lot of people, more women than men. Why don't you talk to someone, listen to someone who has this diagnosis, and you will see that their life is almost normal. And then I send them to FAC because I know you have Trudy is a good example. Lynn Cooper is another one. I know so many people who are excellent examples of a life with fibromyalgia, but it's not controlled by fibromyalgia. They are in control, and it's possible. I tell my patient it is possible to live a good quality of life. Search for some role models, connect with people who have fibromyalgia. You will be able to see. And then, because by now, having the diagnosis, you think you're the only one and you don't know what to do. This is going to impact all aspects of your life. And doesn't need to be that way. You are in control. There are many things you can do. Will help you. I'll give you information. I'll guide you. But they are the ones ultimately who have to open the website, go and watch the webinars and attend. I can't do this for them. So that piece of motivation sometimes is hard. Yeah, but
I find that with FAC too.
Yeah.
That motivation is the difficult piece. I'm going to go over to you, Tyler. Do you, when people get with fibromyalgia get to you, are they still in the grieving process?
There are times, right? Or I'm recognizing that in some way and being able to understands the limit of my skill set and knowledge base. So just if somebody is coming into my office and I'm hearing a lot of things that would signify that they're in the grieving process, I would certainly try to get them in with Eleanor or another psychologist or a counselor or somebody that they trust. Or gearing them to FAC or for anyone else that can help support them through that. And knowing that sometimes knowing you're not alone, right? And that there's others with lived experiences can be so healing and help you guide you through that process. So that would be often my approach if somebody was coming to me, and I'm recognizing that.
Thank you, Tyler. And I left you to last, Eleanor, because I know this is your forte.
Oh,
And so I'm sure there are lots of people with fibromyalgia that you see that are still in the grieving
yeah.
non-acceptance, because you have to go through that grieving first. You're grieving your past life.
Yeah.
So what do you suggest?
Yeah. Oh, it's a big complex question. And the whole, we can say acceptance is kind of perhaps part of the grief cycle. These things are not mutually exclusive and not linear, right? So we can fluctuate between more acceptance and then back to grief, where things can feel very doomy, very gloomy, maybe some hopelessness and sadness for loss. I think it's a very normal, and I've seen it many times, experience the grief to come kind of acutely with diagnosis. And at that point, it's a bit complex because often, I don't want to call it a hypothetical grief, but it's very psychological. The person is trying to prepare themselves for what they may lose, right? They might say, oh, I always wanted to run a marathon and I didn't get to that yet, but now I think I may never because of this diagnosis. Or I always wanted to put on a backpack and travel to Asia or something. So again, not necessarily hypothetical. I'm not coming up with the best word right now, but it's often a grief for what they would hope was coming, right? Like everything else, I think I keep speaking about this, the opening up of space is so important. It's so important for us to be able to talk about these things. It's so inherently therapeutic to share that. The group therapy, it's coming up, absolutely, that to be heard by others, and especially the sense of some shared experience, is inherently therapeutic on so many levels for us human beings. But like life is full for me, and I'm kind of into some Eastern traditions as well, like the karmic cycles, where life is full of birth and death cycles. And I think we can always look at the grief to understand what is so meaningful, right? Why did you want to run that marathon, right? Is huge accomplishments or the travel or uh, challenging yourself physically, mentally. And through the grief, we can often connect to what is so meaningful to an individual. And often there's a chance for rebirth, for an adjustment of a goal or an adjustment of a timeline or a tool to help with that goal, or a new goal that might look so different, but really touch on that foundation of what, comes really from someone's heart or someone's life experience and all that as well. So I think, again, there's always space for both. When we go into the darkness, we can get in touch with what really lights someone up and eventually find our way there.
That's interesting. I've never thought of grief. I always thought of grief as grieving the past, your
Mm-hmm.
past life, and how it's changed. I never thought of it as grieving future you thought you were going to have, but now you think you can't, right? So
Mm-hmm.
that's interesting. I'm going to ask Andrea a question that comes from our audience because I think you'll be the best to answer that. So we have a question that says it's regarding C-reactive protein. My blood work show a really high level of this protein. The doctors I have don't say much about or give me any treatment to help me bring the level low. What do you know about this C-reactive protein? What do you know about, and what is your recommendation?
Okay, so yeah, I get that question a lot. I'm not giving you medical advice specifically to this person, so I'll give a general response. So, C-reactive protein is a marker of inflammation. Any person who sneezes twice because you got in contact with a virus, C-reactive protein will go up. So, it's a non-specific marker that something is going on in the body. And it's not a criteria for fibromyalgia. So we don't need to have C-reactive protein high to say this is fibromyalgia. And if a person has C-reactive protein, then we investigate. We can see if there are other inflammatory diseases going on in the body, like autoimmune diseases like lupus, rheumatoid arthritis, and other inflammatory conditions that I'm not going to list all of them here. But if we can't identify something like a disease that is inflammatory, it may not be. It's not coming from fibromyalgia because we know fibromyalgia does not increase C-reactive protein. But we know more about C-reactive protein now than we knew 20 years ago or 30 when it was the first time that we started measuring CRP. We know that lifestyle modifications is one of the big drivers of high CRP, which means if the person is not sleeping well, if the person is not eating well, it's eating a lot of processed food, not eating a lot of antioxidants, which are fruits and vegetables. If the person is not things, smoking, drinking alcohol, they all contribute to a pro-inflammatory state in the body, and then the C-reactive protein can be high. So there's no medication to reduce CRP, nothing, but work on those things that are more lifestyle, and of course exclude that there is some ongoing inflammation in the body, like autoimmune diseases or infections. There are sometimes ongoing infection, like infestations. Sometimes people have worms in their stomach, or they have fungus going on in their lungs, tuberculosis, those kind of slow infections. Once you eliminate those things, those origins, don't worry. It's not a cause of fibromyalgia, and it's not related to fibromyalgia.
Thank you. Um, Eleanor, I'm going to ask you a question about how do you help patients deal with the stigma of having an invisible illness and remain resilient in the face of misunderstanding, especially, I mean, the misunderstanding can be from your family, your friends, your employer, and sometimes, unfortunately, even your doctor. So, how do you help people deal with that stigma?
Okay, Trudy. I think the first part of my answer is gonna maybe sound fluffy, but it's the most important. It's believing the person and again, making the space for them and absolutely listening and appreciating and respecting their story and their experience and validating it, letting them know, I believe you. This is so real. This is so huge what you've been through. And also explaining to them that I understand that your experiences of being invalidated or denied or whatever were harmful. That was difficult. That for any human being, that is because we are inherently social creatures and we are emotional creatures and we are also intellectual creatures, it is very harmful on the psychological and the physical level to be invalidated. So that experience of like you were actually hurt in this way is important for someone, not just because it's true, but because that's the beginning of the healing for another human being to be like, yeah, I was hurt. Thank you. Someone finally believes me. So again, it's a lot of making space for the story and respecting it. And yeah, it's so unfortunate. Someone can kind of be bounced around the healthcare system and have this experience over and over again. So it's kind of like many injuries, psychological injuries that can add up in this sense. The next pieces of it, can sometimes be a little bit more practical, helping someone navigate their relationships, maybe even some skill building for assertive language or tools of communication, little things I can have in my back pocket that I can say to someone to share my story or to respond when they are invalidating as well. And sometimes, again, a little bit of a buzzword in the last few years, but boundary setting, right? Understanding, when do I get to walk away? Do I get to walk away? For sure, you can always walk away. Sometimes there's consequences, but really like exploring with someone where you're comfortable, where you're not uncomfortable, and what it could actually look like to walk away, whether that's kind of mentally putting up a force field or actually leaving a space or exiting a phone call, for instance.
Thank you. And the last question goes to you, Tyler. It's almost time. I want to leave a few minutes at the end for you each to have something to say. So, how can you share techniques that help patients rebuild trust in their bodies after chronic pain has limited them for so long?
Um, yeah, so it's quite individual in how we can help people rebuild trust, right? In their bodies. Often I would be kind of starting with that movement as a continuum piece, right? So we'd be looking at like the fear, right, of movement and starting with that. And as Eleanor had brought up a little bit earlier, just even the act of like deep breathing, right? How are you responding to that? Because sometimes people even in that space that can feel really scary of being able to kind of take a nice big deep breath and starting to feel their nervous system coming down, right? So we may have to sit with that for quite some time. And then depending on like the goal that we have, right, from a bigger picture, right? So we would take that and we'd use like brief action planning to kind of break it down. We would want to make sure these little movements start to be transferable to that. And there's a process that we would often use and recommend, which is edge work, right? And from a movement perspective, it's kind of back to that concept of challenging but respecting, right? The sensation. So we know we have where we can go to safety with the movement, where our bodies are feeling safe, and then we challenge and start to explore the edges, right? So say if it's if our back is sore, right? And we start with a deep breath, right? So we know when we take that deep breath for the diaphragm to come down, there's like little subtle movements that start to happen in the back. Does that feel safe, right? Or is it when I flatten my back, right? Does that when it gets a little bit scary? So can you, with your breath, start to coordinate some of that movement and until you feel a little bit of it could, let me backtrack. It could be a sensation, right, of pain, but it also could be fear, right, or a breath hold. I don't know if this is going to feel good. We want to stop there, right? We want to work through that a little bit until we can calm that nervous system because as soon as it becomes stressful or fearful, we may be going in a bit of the opposite direction. So we want to build trust, right, with what our body is trying to communicate to us with what we know. So we know that if we take our time and perform these gradual movements, we can dampen that alarm signal a little bit over time and a little bit over time, and we can do a little bit more and a little bit more. So I guess how I would recommend kind of rebuilding that trust is acknowledging fear, right? So, and we had kind of mentioned like we have to meet as healthcare providers, meeting people where they are, right? And so when you give somebody the space to meet themselves where they are, right, that can go a long way too, and that's a bit of that acceptance piece. And then be able to just gradually go through that movement process and go low and slow. I tell people all the time, this is really about long-term goal. This is like stacking paper, right? We just want to gradually layer it up so we're not surprising our bodies in these moments, and we're building that trust that the sensations that we're feeling are accurate with what we're experiencing.
Thank you, Tyler. I have two questions for Eleanor in the chat. One is, what are examples of some of those phrases to use when we're feeling invalidated?
Good question. Okay, great question. And I see the other question about intrinsic emotional processes.
Yes.
Okay.
Yes.
Are we trying to wrap up in the next moment?
In the next few moments, if all of you don't mind going a few minutes over, we're good.
For me, that's totally great.
Tyler, Andrea?
Yeah, a few more minutes.
Yeah, I'm okay. I have something to add here too.
Yeah.
Okay. Go ahead, Eleanor.
I think something along the lines of what you're saying right now doesn't help me is a great phrase because it's not aggressive, it's assertive, right? And it is not really responding to the content. It's just letting the person know that this isn't going in a direction that serves me, kind of wraps it up. What you're saying right now doesn't help me, or doesn't help. We can keep it even a little less personal. Okay.
What about the second question?
Yeah. So this is a huge question. We're speaking a little bit here about memory trauma where there may not be explicit memories. It may be more implicit. And this can come in a lot of forms. Sometimes because of the brain's mechanisms to protect ourselves, we actually forget our memories, right? They can become repressed. That is definitely absolutely real. Sometimes it is because the trauma, which we might call a more subtle trauma or lowercase t, not to diminish it, but it's come through a variety of mechanisms and a variety of life experiences. So it's not necessarily one particular big event that is so cut clear. It's maybe little cuts along the way. And so in that case, we might not even know exactly what caused the trauma. It might be a lot more nuanced. But nevertheless, we don't have this specific memory to look at or these necessarily even specific thoughts. So the cognitive discussion level might not be as relevant here. And this is absolutely where the somatic therapeutic approaches, the breath work, yoga, I'm also a yoga teacher. It's like my big passion, and it's all super interrelated, comes into play. A bit more of a bottom up approach where, because these traumas have absolutely impacted the nervous system and how it is regulated, dysregulated. Often the nervous system is oversensitive now. So it's kind of like an alarm, a fire alarm with many false alarms. The body often goes into that alarm state. So we work actually more with the body through breathing, through very safe movements. Some exploration verbally about what feels scary, what feels safe, what does not feel safe, all of that. And yeah, going from there. And the social piece is a big part of that, because the polyvagal nerve is kind of a great way to help get us into the rest and digest parasympathetic. And it is regulated in a social mechanism as well. So it can be much more effective, for instance, to do breath work with a group of people than with YouTube on your computer.
Thank you. Tyler, did you want to add to that?
Yeah, just sometimes the communication piece, I think, is how do we communicate or set boundaries, right? And so often part of our pain self-management program that we've developed here, one piece is on communication. And so from like a healthcare appointment perspective, there's healthcare navigator tools out there where you that can help formulate how that appointment's going to go, just to provide a little bit of empowerment through those appointments. Those are really nice. But when it comes to communication, often with like loved ones or employers and whatnot, like we often say kind of like three F's and a C, right? So what are the facts of the situation? What are the findings? And what is a fair request that you can ask in that moment of the individual, depending on the context. And then sometimes there might be a consequence of not being able to follow that, for that individual not to follow through with those types of requests. And what that consequence might be is maybe I won't be able to attend for the whole time if we don't make these subtle adjustments. Maybe in, say, if it's a social event with family, right? I've done this previously, and in this coffee shop, there's too many people there. I found after that I had elevated pain and fatigue for the following week. Can we please try another quieter setting this time? And then my fear is that if we don't make this adjustment, that I'll be out another 4 or 5 days and I may miss such event, like something like that. So like the three F's and a C can be a really nice way to just kind of put it in like a little bit of a framework of communicating the experiences and some of the challenges as well.
Thank you, Tyler. And Andrea, did you want to finish up by adding something to that conversation?
No, I just think it's great. There are so many different perspectives. I think the this conversation in itself and having those resources, it's so important because it shows the need for interprofessional collaboration in helping people with fibromyalgia. Like we do need the mind specialist, the body, the physician on board, talking the same language, explaining the same things on the same page. Like the three of us here, we are so aligned with each other. I think we never worked together, but it looks like we are speaking the same language. We're not differing, and this is not happening in real life. Unfortunately, the world out there, each professional sometimes speak a different language. This is what I'd like to add, how important it is that we help professionals to help our patients with fibromyalgia. So this was great. Thank you for putting this together, Trudy.
Well, you're very welcome. I would like to thank you all for being here and for sharing your thoughts today. I think this has been a really valuable conversation. And I think this will be very beneficial to the fibromyalgia community. And I really, really appreciate everyone's input. And I would like to stay in touch and keep this conversation going. So And it's wonderful because I think it shows the fibromyalgia community as well that you do agree, that there's no disagreement among you. And I think there's other professionals out there. We just have to find them, right? And educate the ones that aren't. So I think what you all do is so very important. And I think this has been a great contribution. Thank you. And thank you everyone for attending. It was great to have such a great large audience, actually. It was wonderful. So thank you, everybody.
Thank you so much.
Thank you for having me.
Thank
Yes,
you.
you as well.